This October, important changes have arrived for Texas families relying on the Supplemental Nutrition Assistance Program, or SNAP. Each year, the program undergoes a cost of living adjustment based on data from the United States Department of Agriculture's Thrifty Food Plan. This adjustment is designed to ensure that benefits keep pace with inflation and rising food costs. For 2025, Texas SNAP recipients will see their monthly benefits increase, providing a welcome boost for families working to put healthy food on the table. Let's break down exactly what these new benefit levels mean. For a family of 4, the maximum monthly SNAP benefit has risen to $994. That's up from last year's cap of $975. Though the increase may seem modest, every dollar counts for households trying to stretch their grocery budget. Single-person households now receive up to $280 each month, while larger families with 8 members can qualify for up to $1,789. These new amounts reflect the USDA's ongoing efforts to monitor food prices and inflation, adjusting support so families aren't left behind as the cost of living rises. But these changes are about more than just numbers. They're about real impact. For thousands of Texans, SNAP is a crucial lifeline. The program helps families afford essentials like fruits, vegetables, grains, and proteins, improving nutrition and food security across the state. With the new benefit levels, Texas households can better weather the financial challenges posed by inflation and rising grocery prices. However, SNAP recipients should also be aware of new federal work requirements that took effect on September 1st, 2025. These rules apply to certain adults aged 18 to 54 who do not have dependent children. To continue receiving benefits, these adults must work, attend school, participate in job training, or volunteer at least 20 hours per week or 80 hours per month. Those who do not meet the requirement may be limited to just 3 months of benefits within a 3-year period. The scope of these work requirements will soon expand. Starting November 1st, 2025, additional groups will be affected, including adults aged 55 to 64, parents whose youngest child is 14 or older, veterans, and certain former foster youth. These policy changes aim to encourage employment and self-sufficiency among SNAP recipients, but they also raise concerns about access for those facing barriers to work, such as health challenges or limited job opportunities. Looking to the future, Texas is exploring further changes that could reshape how SNAP benefits are used. The state has formally requested a waiver from the USDA to prohibit purchases of unhealthy foods like soda and candy with SNAP dollars. If approved, this move would be a significant shift, designed to promote healthier eating habits among recipients. Texas officials believe that steering SNAP spending away from sugary drinks and candy could help reduce rates of chronic diseases related to poor nutrition. These proposed restrictions are slated for implementation beginning April 1st, 2026. Under the new rules, SNAP recipients in Texas would no longer be able to use their benefits to buy soda and candy, signaling a broader effort to align public assistance programs with public health goals. While some applaud these efforts to encourage nutritious choices, others worry about restricting personal freedom and the practical challenges of enforcing these rules at the checkout counter. Meanwhile, there's ongoing concern about the future of SNAP funding in Texas. Reports indicate that the state could lose nearly $2 billion under potential federal cuts to Medicaid and SNAP, which would have a profound impact on vulnerable communities. Texas food banks warn that such cuts could worsen hunger across the state, putting additional strain on organizations already working to fill the gap for families in need. In summary, the latest developments in Texas SNAP benefits reflect a complex balancing act. On one hand, increased monthly benefits offer crucial support to families facing rising food costs. On the other, new work requirements and proposed restrictions on unhealthy food purchases signal a shift toward encouraging employment and better nutrition. As Texas continues to adapt its SNAP program, the impact on families, communities, and public health will be watched closely. For SNAP recipients and their advocates, staying informed about these changes is essential. Whether it's understanding new benefit levels, meeting work requirements, or preparing for future restrictions, knowledge is key to making the most of available support. As policies evolve, the ongoing conversation about hunger, health, and opportunity in Texas remains more important than ever.